Hi, I'm Dr. Dralos. This is a lecture on terminology of the gastrointestinal system. The gastrointestinal system includes the digestive tract as well as the accessory organs of digestion. Its purpose is to break down food into smaller and smaller components until these components can be absorbed and assimilated into the body. Gastroenterology is the medical specialty focused on the digestive system and its disorders. The word gastroenterology comes from gaster, meaning belly, enteron, meaning intestine, and logi, meaning study of. Now we'll review gastrointestinal anatomy. The pathway of food through the GI tract is the mouth to the esophagus, to the stomach, to the small intestine, which includes the duodenum, jejunum, and ileum, to the cecum, then the colon, including the ascending, transverse, descending, and sigmoid colon, and finally the rectum and anal canal. The accessory organs include the tongue, which enables taste and manipulates food for chewing and swallowing. The salivary glands produce saliva, which begins breakdown of starch and fat, protects the teeth, and moistens the food, making it easier to swallow. The pancreas secretes digestive enzymes, which break down carbohydrates, proteins, and fats. The pancreas also has an endocrine function discussed in an earlier lecture. It produces insulin and glucagon to help regulate blood sugar levels. The liver has many functions. It detoxifies the blood. It synthesizes proteins that are necessary for digestion and growth. It stores sugar as glycogen, and it produces bile, which helps break down fat. The gallbladder stores the bile that's produced by the liver. The bile is later deposited in the small intestine to aid in digestion. The stomach is a muscular hollow organ that performs chemical breakdown of food using hydrochloric acid and enzymes. Hydrochloric acid serves an additional purpose of killing or inhibiting many bacteria. Food stays in the stomach for around 40 minutes to 4 hours before it moves into the small intestine. The small intestine absorbs nutrients from food. It receives bile and pancreatic juice, which aid in digestion. It is longer than large intestine, but is referred to as small because it has a narrower diameter. The three regions are the duodenum, which prepares food for absorption, the jejunum, which is specialized for absorption, and the ileum, which absorbs vitamin B12, bile salts, and any other products of digestion that were not previously absorbed. The large intestine is the place where water and salt are reabsorbed. Waste material is then removed from the body through defecation. The large intestine includes the cecum, appendix, colon, rectum, and anal canal. The colon is divided into 4 parts: the ascending colon, transverse colon, descending colon, and sigmoid colon, shown in this diagram. Now we'll go through Latin and Greek roots that are relevant to the gastrointestinal system. Append means appendix, for example, an appendectomy, which is surgical removal of the appendix. Bili means bile. Bilirubin is a yellowish pigment that's found in bile. Hyperbilirubinemia is a condition where there's too much bilirubin in the blood. This can lead to jaundice, which refers to yellow coloring of the skin and tissues caused by excessive bilirubin. Buck means cheek. For example, the buccal mucosa refers to the inner lining of the cheeks. Celi means abdomen and is the root of celiac disease, which is an autoimmune condition where the patient is intolerant to gluten. This condition primarily affects the small intestine. Cholangy refers to the bile duct. A cholangiogram is a type of imaging study to examine the structure of the bile ducts and gallbladder. Cholecyst means gallbladder. A cholecystectomy is surgical removal of the gallbladder, while cholelithiasis refers to one or more gallstones in the gallbladder. Choledoche means common bile duct. Choledocholithiasis refers to one or more gallstones in the common bile duct. Cir means yellow. Cirrhosis is a disease of the liver that often causes jaundice, yellow skin. Col means colon. A colonoscopy is an examination of the colon with a long flexible tube. It's often used as a screening test for colon cancer. A colostomy is a surgical procedure where a part of the colon is diverted to an artificial opening in the abdominal wall. A colectomy is surgical removal of part or all of the colon. Diverticule means diverticulum, which is a blind tube that leads from a cavity or passage. Diverticulosis is a condition where small pouches develop in the digestive tract. Diverticulitis is a related condition where these diverticula become inflamed or infected. Enter means intestines. Enteritis is inflammation of the small intestine. Gaster means stomach. Epigastric refers to the upper middle area of the abdomen, which is near the stomach. Gastritis refers to inflammation of the stomach lining. Gastrostomy is a surgical opening into the stomach from the abdominal wall for the introduction of food. And a gastrectomy is surgery to remove part or all of the stomach. Gingiv means gums. For example, gingivitis, which is inflammation of the gums. Gloss means tongue. Glossitis is inflammation of the tongue. Glossopharyngeal refers to the tongue and the pharynx, for example, used in the context of glossopharyngeal abscess. Hemat means blood. Hematemesis is vomiting blood. The root emesis means vomit, and is also used as a standalone word. Hematochezia is passage of bright red blood from the rectum. Chezia means passage of foreign substances in the stool. Hepat means liver. Hepatitis is inflammation of the liver, while hepatomegaly is enlargement of the liver. Ile refers to the ileum, part of the small intestine. An ileostomy is a surgical procedure where part of the small intestine, part of the ileum, is diverted to an artificial opening in the abdominal wall. Lapar refers to the abdominal wall. A laparotomy is a type of open surgery of the abdomen, while laparoscopy is a procedure where a fiber optic instrument is inserted through a small hole in the abdominal wall in order to view the organs inside the abdomen or enable a laparoscopic surgery. Melis means black. It's the root of melena, which is black tarry stool that indicates digested blood. Phage means to eat or swallow. Dysphagia refers to difficulty swallowing, while odynophagia refers to burning pain while swallowing that's caused by irritation of the esophagus. Proct refers to the rectum and anus. Proctocolectomy is a surgical procedure that removes the colon and rectum. Sial means saliva. Sialadenitis is a swollen salivary gland. Sigmoid refers to the sigmoid colon. A sigmoidoscopy is the minimally invasive examination of the large intestine from the rectum to the sigmoid colon. Spleen refers to the spleen. Splenomegaly is enlargement of the spleen. Steat means fat. Steatorrhea is a large amount of fat in the feces that's foul-smelling and floats. Stomat means mouth. Stomatitis is inflammation of the mouth that can cause painful swelling and sores. These are some references. Thank you for listening to my lecture today.